Check, check. Hey there, so I wanted to come with you today. I don't like that way I started that out. I'll not come with you. Yeah. Yeah, I know. Hey there, how you doing? Really wanted to talk today about what a day one neck, pain or strain would look like. What would I do or give to someone if they came in, either an accident, a fall, or they just woke up funny and they have that acute it could either be like even have a deformity or feel like I just can't turn, or one that's really what we'd call like a hot neck where it'd be maybe even some ridiculous symptoms like into the shoulder blade or down the arm, because they're very painful. One. Two, they're kind of it's fearful, it's scary. When we talk about necks, you're thinking, well, am I going to be paralyzed? What's going on? How do I get this thing fixed? And a lot of actually clinicians that you'd go see will be fearful of moving the neck as well. They're like, I don't know what to do with you. They'll just give you something real simple. So, what would we do on day one for neck, shoulder pain? Thoughts on that, Jake?
Yeah, first we start asking some questions so we can better understand how this came on, any history of this going on, and just make sure that there's nothing like crazy, like car accident or something where we got to rule out things like fracture or anything like that. Just make sure nothing crazy going on.
Yeah.
Once that's ruled out,
If there was an accident, then
Yeah.
we would want to get some scans and some X-rays to make sure. But that's a good point.
yeah. So after we have an idea of what's going on and know that they're safe to at least start moving around a little bit, we'd probably just start and get some baselines.
Yeah.
So
For this example, let's just say that it was not a traumatic accident.
perfect.
They just woke. They went to bed, woke up, and they're like, oh, I just can't. I can't turn. I have pain into my right arm.
Yeah. So we'll start. We'll check baselines, just get some range of motion in all directions. So we'll usually do. Here you can demonstrate here, Chris. We'll just do some flexion, looking for any mobility loss, pain production. So he'll be tucking the chin down to the chest.
You first have to make sure that you sit very well with posture. So what happens is people will sit this way, and then you just really can't get that motion anyway because the way the mechanics of the joints line up, unless you're nice and tall, hips all the way to the back, that will automatically bring you into a better posture anyway.
Yeah.
Okay, the first one would be to really kind of turn left and right.
Yeah. Check rotation, both sides. Usually these people have one side that's like very blocked and the other side to be stiff. We'll also check ears side to side. Again, there'll almost always be that like tension or that pull coming down through the neck and into the shoulder, into that one side. And then we'll see a lot of limitation in people, flexion usually, and then extending backwards. That's where people will get that hard like block or that stuck or that pinch or production of pain. So from there, we'll just start going through some simple movements to try and modify or change those symptoms. So Chris kind of show them what we'd normally start with.
So day one tends to be very, very safe and have the benefits far outweigh the potential risks of going with a very easy and light, what we just call retraction and sitting. Again, the setup is you have to get all the way back, sit in a nice firm chair. You can't do it in a recliner. You can't do it in a soft couch. Nice and tall. And we're just going to bring the whole head and face straight back. What that does is it gets some lower cervical extension, some upper cervical flexion, which tends to be the exact opposite of where we usually spend our day, which is protrusion, right? So we're usually here. It's easy to do this from typing and everything else. And so when you go into that retraction, it gives us a lot of information. It can produce pain. It can reduce pain. It can pinch. It can send different symptoms places. But usually you can feel something when you do it, but then as soon as you stop, no, I'm no worse. And that's not wrong. It's not wrong to increase or produce a pain by doing that. And it's not down and it's not back. It's straight back, like something's coming at your face. And I'm not pushing, I'm just guiding. Pressure on, pressure off. Pressure on, pressure off. And each one I'm going to try to get back a little bit further. I'm going to do a set of 10, and then we're going to reassess those baselines.
Yeah, so whatever you saw deficits in the baseline, usually a range of motion test, you'll retest that to see how it feels. Did it change? Is there more range of motion? Is there less pain? Did the pain move from the shoulder closer to the neck? We're just gauging for symptomatic changes or increases in the range of motion is what we're looking for.
And if in some cases, even if you can't do the retraction in sitting, we like to do it in sitting. It just tends to work best with having the gravity and the weight of your head. If you can't, you can do it lying down. Put a little rolled up towel back there, right? So it's kind of supporting the knob in the back of your head. And then just tuck through there when you're lying down on a table. So That would be the secondary way to do that, would be to do the same retraction just lying down.
Yeah. And then based on the information we get from that like movement screen and range of motion testing, that will give us some better ideas of what exercises you might be able to tolerate or start working into, and what, from the chiropractic side, what adjustments or movements might be safe and effective for you today.
We may even have you and help you, lying down and kind of guide in really extreme circumstances where we can't get much movement at all in sitting. We can start lying down, and then we would still come back up to here and retest and reattempt in sitting. The next one then would be, so first posture, 2 retraction and sitting, nice and easy. If that starts to make some progress on day 1, we'd probably just stay there with those 2. If you really feel a lot better, you could start to go and let it fall back a little bit. So it'd be retraction first, then let it roll back. That would be the next. Or to support with your hands and go in and then back to kind of help support that. But that would be one huge step up that we may not even get to on day 1.
And it's good to understand that like there is going to be some pain production as you're working through these movements, which isn't necessarily bad or wrong, as long as the changes in the end, the net positive outcome is better than what you started with. So working into the pain is often something we need to do. Usually you just touch it and then come right back out of it like Chris said, and then gauge it
Go a
based
little
on your
further each time,
tolerance.
just half inch, a little further each time,
Yeah.
and it will loosen up more than likely.
Yeah. So there you go. That's a day 1 neck right there.
Thank you.
Hello. How are you doing?
You ready for